Change can best be tracked when the agents of change are involved in the process of change itself. A movement of the people, for the people, and by the people saw the beginning of Paheli, a people's assessment of health, education, and livelihood. The Paheli exercise was initially undertaken in 2006 across 11 of the poorest and most backward districts within the country. Using the standard PPS sampling technique, 30 villages were randomly selected for each district. This project reached the farthest states of Arunachal and Nagaland as well. Upon review of the learnings and experiences from Paheli 2006, a need was felt to repeat Paheli in 2011. This project has been undertaken in joint collaboration with the Government of India, the UN Joint Programme on Convergence, which included the Planning Commission, UNICEF, UNFPA, and UNDP, along with Pratham and Asar Centre, assisted by Arghyam and the Accountability Initiative. The actual survey was carried out by multiple local partners in many of these districts. Paheli adopts a participatory model with high citizen engagement and action at the grassroots level. Paheli 2011 data collection began in June across 8 districts of Gumla, Hardoi, Korba, Nalanda, Rajgarh, Sundargarh, Udaipur, and Bhilwara over a period of 3 months. The survey involved trained 2-member teams visiting 60 randomly selected villages in every district for 3 to 4 days. The exercise generated a simple, easy-to-use toolkit to measure 4 key human development domains of life and livelihood, water and sanitation, maternal and child health, education and literacy. Alongside, a set of district report cards for each of these states was also prepared. However, for many who participated in the exercise and travelled to the villages, the lessons learned have been invaluable. Activity-based assessments increase engagement within communities and create opportunities for greater awareness building and action. Therefore, asking people to read a paragraph or test whether water is potable led to a great deal of discussions among the villagers. This project also identified domains where a rapid assessment technique may not reveal the whole story. The simplicity of such a technique offered the scope to work in greater detail with issues relating to land and work, immunization, infant feeding, etc. Fund tracking exercises were undertaken and proved to be effective within the health sector, but less productive at the time of collecting information for the public distribution systems and the Mahatma Gandhi Rural Employment Guarantee schemes, where substantial amount of funds were involved. Today, everybody in the country has the right to ask, what is life like for the people in our villages? Are they able to access and benefit from government programs? And is there a way to measure and learn from our villages on better policy and practice approaches? Paheli essentially is an exercise in learning and assimilation. The scope of replicating this model at multiple levels across multiple sectors is immense. It opens the possibility to monitor human development outcomes and delivery of basic services. Paheli is a key step towards enabling decentralized planning, where communities can engage and begin to improve their own conditions and demand better services.